The first thing I'd like to do is play you about a 7-minute video, and this is one of my patients, Adrian, who's done amazingly well. He'll tell you his own story, and then I will summarize the key points. But let's just see if you can actually hear the sound. I did check the sound box, but let's see.
Okay.
Title is meeting controls. PowerPoint slideshow that enters doesn't paint but PPT slide.
Right. This is why I will have to share for you to hear the sound, and then I'll have to share again because you don't want my sound for the rest of the presentation, right?
We can hear it, but it sounds very fast, like it's
yeah, it is very fast.
Speed it up. Okay.
Yeah, that's fine.
Title is PowerPoint slide.
So here's Adrian for you to begin.
Slide through dash slide. Group object. Heading level 1 Adrian story testimony link video Adrian testimony.
No, it's gobbledygook. It's
My name's Adrian Rudge.
Oh, hang on, got it.
Safety advisor. I was diagnosed with cancer in 2012 and had an operation, radical neck dissection, in 2013, followed by 30 sessions of radiotherapy, including 2 chemo. In that time, I've attended work groups for scar work therapy, and it's during this time that I met with Sarah. I have been having troubles with my SCM, which was severed during the operation. Had a lot of scar tissue, and the whole muscle and the surrounding area has felt like a piece of wood for so many years. Through the scar work therapy, that has eased it, but that was for the visuals. But there's a lot of scar tissue underneath, surrounding the SCM and the other tissue. I felt that I needed further assistance in treating the SCM and trying to get its feel away from being like a piece of wood to becoming more supple, looking for better movement and rotation within the shoulder and the neck, and also any other areas of the body that had been affected by the operation that I was not aware of. So having met with Sarah at Scar Work Therapy, she had a sort of feel around and did some work on my neck. I normally have a very stiff neck at the end of the day and the following morning. Sarah assured me that this wouldn't be the case, and rightly so. On the following morning, my neck did not hurt at all. So that gave me, sort of great excitement. I then enrolled with Sarah, and she put together a team who I need to see. We did quite a bit of work on rotation of my upper body, around my neck, etc., and looking at other areas that might be affected, such as my spine and my hips. And Sarah did some work on those for me as well. I was also introduced to a team, Christine, who is the dietitian, Andrea from a more holistic point of view, and David from a PT session. I quite regularly work with David in half-an-hour sessions. The work that we're doing, the stretching and the exercises, I feel, along with the holistic work from Andrea and the dietary information from Christine, have all sort of helped me improve my well-being and improve my overall feeling within me, almost giving me a reset button. I'm able to undertake exercises without my neck giving me a lot of grief, so I'm really pleased with that. My diet, I've made some tweaks to that. I found out that I had a intolerance to yeast, so I've now started searching out foods that don't contain yeast. And then from the holistic side of view, etc., some good bits of meditation, readings, and just some mind health, and I find that has helped as well. I now do a combination of all 4 things, which can certainly help me progress forward. I want to get back to the gym again full time, and I think this may have just given me the lift up the rung that I need. I'm drinking a lot more water, which was a recommendation, and I'm feeling good with that too. I've got a routine to get up in the morning. I'm awake at 7:30, and I commence the day drinking 250 to 300 mils of water, followed by my stretching exercises. And there's a combination of 10 or more that I rotate every day. That's then followed by some tapping, which I got from Andrea. and that's on the head and the upper body. And also then either following the morning workouts, do some 10 minutes of meditation or later in the day. The continued work with Sarah is going well with regards to the shoulder and what I would call the realignment of my body. There's certainly a lot more movement, flexibility. I'm certainly standing more upright. And I think this, you know, from a team perspective, has been very good for me.
Can now see your application.
I think going forward, this is going to give me a great or a better outcome from when I'm doing my workouts and other areas within my life. If I need to get in touch with any of them anytime, then I can do.
Great, so thank you for that. So what is the biggest win of you working with Sarah compared with other treatments that you've had in the past? What's the main difference and the main win for you?
The main difference between Sarah and other people I've seen in the past is probably that the previous people have, and probably, you know, because I've told them that my neck is giving me, you know, difficulty, and it's tend to focus around that area. Whereas working with Sarah, we've looked at other areas of the body and started with those areas and corrected those areas before we've gone on to the SCM and the shoulder. And I think that has been the biggest win today so far.
Great. And in summary, what are the 3 biggest changes you've observed since starting the treatment?
If I was to say 3 biggest changes, water into my diet, that was an easy one. So that was a quick win. The working with David on the PT has been good, because working that area and stretching instead of probably exercising has given me that mobility. And also, in my opinion, it is connecting the other muscles, the upper traps and the lats, etc., bringing them into play more. And also with Sarah, with the manipulation of the upper and the lower body, I'm not getting any lethargy. I feel good after my workouts, and just overall well-being. And that's not to forget the work done by Christine in highlighting the fact of what I was intolerant.
Great. Thank you very much.
You're welcome.
Isn't he lovely? He's just fantastic, isn't he? So that was Adrian in his own words, the slightly unedited version. And what I'm going to do now is unpack a few key points. So yeah, let's unpack some of what Adrian was saying, because we know he can talk for Team GB. But you know, the reason I actually work over his larynx is to keep him quiet for a bit. No, he's great. No, he's lovely. So in 2012, you can see the picture of him in bed 7 days after his operation, with very red and visible scarring all around his neck. Can you see that?
Yes.
Yeah. This was tonsil cancer. So it was, and he's very open about this. It was human papillomavirus, and this was a primary cancer, and that was removed. So a radical neck dissection. So it went all the way from sort of behind his ear, all the way around, tethered in. He talks a lot about the SCM. He's a health professional himself. The big muscle at the side of the neck, that when you turn your head, you feel that stick out.
Yeah.
If you imagine, he didn't have one. It felt more like bone than anything. Or he said a piece of wood, but yeah, you didn't get that sticky out border of the muscle with him. So he had that removed, and because of where it was, he had to have the lymph nodes removed as well, secondary cancer. And he had some drain valves inserted as well, to compensate for the lymph nodes. Okay, so that was him when he first had it done.
Space.
And then that should move on to 2013 now. Is that right?
No, it's still with the 2012.
PowerPoint slideshow dash cancer stars and pain PPT.
There you go.
Oh, yeah.
Oh, we are.
Yeah, that's good.
Hey.
Yeah.
So in 2013, you can see a picture of him sort of 8 weeks after the initial surgery, and he looks better, doesn't he? But it's still very visible, still very clear, distorted shapes, and the adhesions, because of course the layers of tissue after an operation, they stick together, as some of you know, and you can very much see this on the photo. He had 30 radiotherapy sessions and 2 chemo sessions, and he had a peg fitted. So he got another scar fitted in his sort of abdomen area, upper abdomen, because he was unable to take sufficient nutrition by mouth. So, and I don't know if you know this, but if people have got multiple scars in their body, they actually migrate towards each other. And that, of course, then affects the posture of the whole body. So if you've got scarring in your neck and scarring in your abdomen, you're going to sort of fold forward. Not so dramatically, but over time, you will. And then in June, he started having some physiotherapy. So this was his rehab. Fast forward a few years.
Slide 5 Adrian story colon through 017-2017
From 2017 to 2021.
Speech on demand.
He met some, well, went to one of my tutors actually for professional monthly scar work sessions. This is Sharon Wheeler's scar work. There are many scar work modalities. The one I practice is the Sharon Wheeler one. And he received this professionally from our tutors for 18 months. And then realizing because he could get some student sessions for free, and he had as many as he could. So he turned up at our student clinics and had all the students practicing on him. And he's so open about his story that he's quite happy to share. So he probably had about 4 courses of that per year. And the scar work improved much of the visible appearance of the scar. I think you've got some pictures there, haven't you, as well? Or you will have in a minute. The muscle was still very tethered in underneath, though, causing pain and postural compensations. So the big side muscle at the neck is responsible for flexing the neck forward and turning the head as well. But if that muscle's tethered in, then other muscles in the body are going to start compensating. We know that any one action is multiple muscles working together, but the other muscles are going to be bearing more than the weight than they ideally would. So then this is going to affect posture. So when we started working together, I was a scar work student in April 2021, and we were all still wearing masks and still very much coming out of the lockdown. And he came again, as I said, he was happy with the visual appearance. It wasn't too bad, but he was still not happy with what was going on underneath. The scar work students come from a range of backgrounds, from sort of beauty therapists, the more aesthetic, cosmetic end of things, to people that have done massage qualifications. And then there are people like myself that have done more advanced remedial clinical body work that get involved with the scar work as well. I also had a background in speech and language therapy before I did this in the health and wellbeing industry. So I have no problems at all with working around the front of people's necks and over their voice boxes. And a lot of therapists just don't want to go there, but it doesn't bother me in the slightest. You know what the red flags are. So I was quite confident perhaps to start manipulating the tissue underneath. And like he said, it did feel just like a piece of wood. And I was just sort of sat there with him, unraveling him and sort of coaxing, and it started to soften. And he said, oh, it's probably going to hurt like mad tomorrow morning and then give me grief in the night. And I said, no, probably not. I don't think so. I don't know why I didn't think it would, but I didn't think it would, and it didn't. So we then embarked on an intensive 3-month program of body work, which was primarily me, not exclusively. Nutrition to see what was going on and give his body the optimum chance to heal, and hypnotherapy. He was feeling very lethargic. He really had the lockdown blues, well, didn't we all? But he really had the lockdown blues, and some exercise as well, because he wasn't ready to get back to the gym. And then 9 months of further intensive monthly bodywork sessions that we had together with another therapist in tandem. Because he had the scar over his larynx, I brought in one of my colleagues who is a voice specialist osteopath just to have a look. And he said, actually, do you mind if I just come here and do this? And before we knew it, we were working together on Adrian, and now we work together on loads of people, and we do it all the time. And actually now he gets paid for the privilege. So and Adrian says he loves having 2 of us working on him, actually, because he just he says when you've got one person on each end of your body, you can do nothing but surrender to it. So where are we now? I think we're still on the right slide. This should be the results after working together, the outcome. Is that right? Yeah, great.
Wow.
Good.
Very impressive.
So yes, you can see him now.
Looks fantastic.
Now, I can't take all the credit for this because he had monthly professional work and then a load from the students. But in terms of the function and that the muscle actually starting to work. So the scars are fairly visible, as you can see, slightly over the larynx, but otherwise not really. But what's really exciting me is that the SCM muscle now feels like a muscle. And a few sessions ago, it was really softening up and really sort of getting untethered from the underlying tissue. And I said, Adrian, can you just raise your head off the table? And the muscle tensioned, it contracted. Well, except muscles don't contract, but it moved.
Wow.
That was so exciting.
Sarah, can you read are you able to read the chat messages, or do I need to read them out?
At the moment, I can't, while still focusing on the presentation. So if there's anything that's coming up relevant and timely, please do squeak.
Okay, so Adriana has just said, amazing progress, fantastic example of teamwork photo. There you go.
Thank you very much. That's lovely. But yeah, not just how he looks, you can see that, but he's less lethargic, he's more energized, he's going back to the gym, and he's been helping his mate clear out her house. In fact, last time he came to see me, he had a new scar because he dropped something heavy on his foot. So he's back up and running and doing stuff. Oh yes, and he had sore legs from doing all the hill walking. He's got meditating and exercising every morning. He's pretty much cut wheat from his diet, and that wasn't what he came for, but he's feeling better, and he is now back doing the gym. So I think when I took that testimonial, he wasn't back at the gym yet. I think he said he wanted to. Now he does. So that there is. So just a summary of comparison. You can see the difference between when he first had it done and afterwards, when we've all had a bit of a go at him.
Wow.
Amazing.
Just looks like a wrinkle, doesn't it?
It really does. Wow.
Fantastic. So moving on. So I'll talk to you a little bit about what it's like to work with me, and at the very end I'll put my details on and get people's details if people want to have a chat with me following this to see whether my team might be able to do anything for them. But won't do that on this call, but we will put the contact details out there, and you can put things in the chat to me privately if you want me to give you a ring, and we can have a private chat then. But getting private treatment like this compared with the NHS is great. It saves life. But I often hear people saying, they've saved my life, but I feel like I've not been put back together again. Has anyone felt that they've had amazing treatment and the doctors have done everything they can, but they still don't feel quite themselves? Does that ring true?
Definitely.
Yeah.
Yep.
You feel like you've been taken apart and not put quite back together again?
Yeah, definitely.
Yeah. So it complements treatment received on the NHS. I do not claim to, I'm not a cancer specialist, I'm a scarring specialist. So it complements the chemo, the radiotherapy and the surgery. And with the various treatments that I offer, because I don't just do one thing, we can help manage the symptoms of cancer and the side effects of conventional medication. I don't claim to cure cancer, and any holistic therapist who does, and I'm afraid some do, I have come across the more sort of esoteric healing claiming that they can cure cancer. It's not legal to, if people may have amazing experiences and may find miracles do happen, but it is not legal to make these claims, and I don't make them. Okay. So things like pain, nausea, fatigue, digestive upsets, breathing difficulties, we can alleviate all that. So my mother-in-law at the moment, she has cancer, and actually she's recently made the decision to discontinue her chemotherapy. So, I've got this going on in my own life. What can I do for her? She's been coughing a lot because it's pelvic cancer, it's metastasized to the lungs, and she's coughing. What I can do and do is treat around the neck, the shoulders, the back, and the chest area, the rib cage, to make it easier for her to breathe. She's also very constipated because she's on opiates. Don't know if that rings true for anybody, but some of the medication can really turn your digestive system into the M25. However, I can't work on her abdomen because it's pelvic cancer, so there are limits, and I'm not able to treat that area directly. So then it's a case of managing it with movement and medication. And also the sort of treatments that my team offer, they're pleasant, they're nurturing to receive. It's not awfully nice, you know better than me. I have had surgery, having needles stuck in you, having medications that may shrink the tumours, but may have some pretty horrid side effects. Whereas what we do with people in the main is very nice to receive, and people feel that nurturing and being looked after. And then that may then improve the patient outcomes. So particularly in someone like Adrian, the mobility, the strength, the stamina, and the appearance of the scar. So my focus is not on the appearance of the scar, it's on the function of the body, well, it's on the health and well-being of the person. I come at scars from a where is this stuck together approach, but obviously some people are really self-conscious about the appearance of scars, and we're going to make a difference to the appearance, even though that's not the primary aim. It's to make them feel better in the body, but then it actually looks better, which makes them feel better psychologically. So it's a win-win. So would you like to hear now a bit more about like how a scar affects the whole body and why that is? Would that be helpful?
Yes, that would be
Yep.
interesting.
Yeah.
Great.
Definitely.
How scars affect the whole body. It sort of rucks up and sticks the skin to the underlying structures in one area and creates a pull. I meant to bring like a peg from the kitchen, but if I get hold of my shirt where you can hopefully see it and pull it, that's created a line of drag. And if I try to move my arm back now, that's quite difficult to do because I've created a rucking up. And when I move my arm in different directions, I can now feel that actually pulling under my armpit, which is not the source of the sticking has been created sort of at the front of my chest, and I'm now feeling it tight under the armpit, which is a classic example. If you try it yourselves, you could, if you're comfortable to do so, pull a bit of your shirt down at the front and feel how it rucks up at the back, or just make it a little, if you're able to make a little pull in your clothing and see where you feel it remotely from where you're actually pulling it, and it pulls tight. Or if you've ever sewn up a hole in a garment and found that it doesn't feel quite as comfortable as it once did, or tripped over a long skirt. I'm a church chorister, and I still sometimes manage to kneel on my cassock. And the first thing I know about it is I can't straighten my back up and it's pulling up around the back of my neck, even though the problem's actually under my knees. So many examples of how the body is all joined up. So a pull in one area is going to affect the rest of it. So this is where we're on to fascia. So you can see a picture there of the muscle sheath. The fascia. Has anyone come across the fascia already?
No, I don't even know what fascia is. So,
Well, you're going to... So if you imagine your body underneath the surface of the skin has got a great big onesie, and it's a total onesie, a sort of elastic, not the sides is really a sort of elastic, semi-liquid wetsuit. In fact, there's a book been published recently called The Living Wetsuit, and it's a great book, or a sling, and it connects and supports all of the other structures of the body. So it forms, you cut into chicken, and you peel off the skin, but then there's this other thin stuff that you pull away. So apologies to any vegetarians. Yeah. And this fascia, it knits into and forms all the various sheaths around your muscles, and there are lots, ligaments, tendons, and the membranes around your internal organs, and the membrane sort of around your bone as well. And the blood vessels and the nerves come through holes in the fascia. In fact, I think there's an 80% correspondence between acupuncture points, acupressure points, the Chinese ones, and the points where the nerves and the blood vessels exit the fascia. So this is old stuff, and the new science is proving it. So the fascia then holds the whole body together and enables it to function as one integrated unit. So modern 21st century anatomy, we don't even really think about this muscle does that. When I flex my elbow, the biceps does it. When I straighten my elbow, that's the triceps. That's very 20th century, and now it's very much like the whole body working as a single unit. And when it's all working nicely, if you imagine this sort of onesie or sling system of the fascia, and the forces are evenly distributed through the fascia, allowing healthy movement and function. The organs move around as they should, the digestive system all moves around, the womb's happy, you name it. But what's also really exciting is this is a sensate fascia, and it contains more sensory nerves than your skin does. And they communicate with the brain about posture, about movement, where the body's supposed to be, and about pain. So not only by working with the fascia can we work on the whole body, but we can also send new nerve signals to the brain to give it new information and create subconscious learning, which is really exciting. Making sense?
Question.
Yeah.
So massaging the skin, you're actually working the fascia at the same time?
No, not necessarily. Just hold that thought and it should become clear. If it's not clear in 2 slides time, you can shout at me again.
Okay.
All right, so when fascia goes wrong, so how the body's put together, now it's how it falls apart, this Humpty Dumpty. Again, you can see the muscle structure and somebody's in pain. So tension, posture and injury issues can cause inflammation and dehydration in the fascia, making the fascia more solid and sticky. So rather than being liquid and mobile, it will get sticky. And this creates strain lines throughout the body, like we just demonstrated with the clothing. And that means that the forces are no longer evenly distributed through the body, causing pain and loss of movement. So some bits are bearing more force than they should, others are not pulling their weight. And therefore, where the client feels pain may not be the root cause of the problem. So this is, again, very 21st century. If you go for a back massage because you've got a sort of stiff, sore muscles at the back of your shoulders, has anyone had that, been for a massage because their sort of upper back and shoulder blades were aching?
Yeah.
Yeah. And so how many of you, let's roughly, have had that? Yeah. Okay, cool. And did your therapist just massage your back, or did they actually turn you over and open up the chest area, the pec area as well?
Yeah, mine did.
Good. A lot don't.
No.
Very pleased to hear it.
Adriana says massage only back.
Yep. Again, if you're forever chasing the pain, you will forever be lost, as Vladimir Janda put it. So yeah, it's treating the other structures. So this might answer the question that came in a minute ago. Myofascial release, what is it? What is it actually doing? So it's not really massaging. It's hands-on, it's body work. Most of us who do it are trained massage therapists first. I think you all have to be. So it's a hands-on therapy which unsticks the fascia, enabling healing and restores balance and movement. So it's getting that function to come back. You work through the skin, but you're not using oil. It's a slow, sustained pressure, pulling, stretching, and facilitated movement. And if you put your hands on, you can actually follow the fascia, follow where it moves. Actually sort of feel, why don't we all do this actually? I wasn't planning to, but if you're able to access a bit of your skin, whether it's on your arm or on your upper chest is ideal, but I just want you to rest your hand on a piece of skin if you can, and just leave it there for a couple of minutes while I'm talking, and see, I'll ask you in a minute whether you're actually feeling it sink in first of all, and then whether you're starting to detect anything. So just hold that. As you've got your hand on, the fascia will change from this sort of sticky solid, if it's stuck, to a more that semi-liquid, the gel phase we call it. And as the fascia moves, it takes the bones and muscles and organs attached to it back to their rightful places. And sometimes the body starts to move and self-correct as well, which is rather like fun. Rather than responding to enforced change, like having a manipulation done. Has anyone been to traditional sort of chiropractic or physiotherapist where they cracked your back?
Oh, no.
Yeah, I had my neck done.
Yeah, not always the most pleasant.
I have.
I
Yeah.
only went once. I didn't go again.
No,
Yeah.
I didn't go back again either.
No, this is the thing. And yeah, there is a place for that kind of work. I have somebody who works with me who does that kind of thing, but only in a very gentle way, and once we've worked through the fascia and everything first. So we're encouraging the body to correct itself rather than enforcing the change. It's a bit like a midwife as opposed to somebody doing a cesarean, a consultant doing a C-section, whereas a midwife is actually facilitating a natural process, if that's a good analogy. The treatment sessions are therefore longer and led by the person's responses. Is anyone feeling anything under their hands yet? Those that were able to access a bit of skin?
To be honest, no, not personally.
That's okay.
No, not quite yet, no.
Okay, so what I'll do is, I'll guide you through it. Put your hand on the skin and just start to gently move the skin over the underlying tissue. And just feel, you'll find if you go to one side, it might move a lot. If you move to another side, it might not move so much. And just see how much movement that is. And you will find that you start to just slightly stick to your skin. Is anyone getting, it's sticking?
Yeah, I am.
Yeah. So you are actually getting
I thought
into
it was just hot.
Yeah, no, you are actually once you start to stick, you can feel the fascia and then just try a little bit of movement and see which way it wants to go. See if it sort of starts to move you. It might do, it might not do. I'll let you play with that. Are you starting to see though that in some directions it's happier moving than others? Is that clear?
Yeah.
Yeah.
Yes.
Yeah.
Well, that's great. So you can tune into fascia. I'll move on for the now. It's good stuff. And the outcome, what's going to happen once you've done this treatment? So the nerve signals are sent to the brain, informing it of the changes, the new posture. Sometimes people get off the couch and they say, oh, I feel wonky. It's like, actually, you're straight now. It's like someone's moved the furniture in your house. It takes a bit of getting used to. And the person becomes more body aware. So one of the first things I get is, oh, I didn't know I was so tight. Oh, you asked me if I did anything more with the right leg than with the left. Yeah, it's the accelerator pedal. Or they go away and start noticing things. And that's great because noticing is half the battle. A brain unconsciously learns a new normal. And these changes are permanent. So this is what's great about fascial work, is that having a massage is not, it can help for several weeks or even months, but it doesn't make permanent change. It's very nice. But if you want the body to make changes that really stay permanently, you need to communicate with the brain, and that's fascial work. It's why a lot of massage therapists go into fascial work, because it works. It really works on a deeper level. Has that answered your question about what you're actually doing? You were saying about massaging the skin. You're working through the skin. Has that made that clearer?
Yes.
Yeah, cool, no problem. The physical tension then, which has been held maybe for years, decades, in response to stress, is released. And the person may experience an emotional release too, particularly if the body starts to self-correct. We call that unwinding, and the body starts to take off and move around all on its own, and the person thinks you're moving them, you've only got one finger on them, you can't possibly be moving them, and yet they're moving. Dismounts off the massage table happen quite a lot in my room, and it's quite fun. No one gets hurt. It's a bit like if you sort of kind of naturally or sort of fell out of bed as a child perhaps and just sort of rolled gently off the bed and started giggling. It's that kind of thing. It's not, no one's going to get hurt. So if you're going to work with me, the discovery process, this is how it works. Someone will have an initial chat, which I'll invite people to do if they want. We talk about what's going on for them. And it's all about discovering what people want to be able to do. Is it that they need to sleep better or go off walking again or start cooking or whatever it is that's important to them in life? It's a 90-minute initial consultation, a physical assessment, no treatment in the first session, inquiry into lifestyle, home life, stressors, relationships, diet, exercise. There's often a lot more going on than the pain itself. And then the intervention is offered within a time frame to help the clients achieve their goals. So whereas most therapists are like, oh, it's X amount per session, I'm much more about what do you want to achieve and how are we going to get you there and who needs to be involved to get you there. So it's a bit like having a project done on your house, or a landscaping, a gardener. Project on your house is a good analogy. You just want the project manager to get the carpenter, the electrician, the plumber. You don't want to have to do all that yourself. So they get the right people in at the right time. All make sense?
Yep.
Yeah, cool. And then the treatment, what does the treatment look like? I'll do this very quickly because Adrian's told you. It's a complete treatment intervention with unlimited work from me, plus a hand-picked multidisciplinary team like Adrian had, exercise, body work, nutrition, mindset. I've even got a lady who does grief recovery, 7-week program to shift sort of major losses, bereavements, not just deaths, but abuse, having to move, losing a job, or whatever it was that happened that can really have a lasting effect. And the freedom that people experience is phenomenal. So we're tackling the cause of pain. And the reason I do all this is because there's always another story. If someone's had back pain for 35 years and they've been to the osteopath, the chiropractor, it's like, well, what else is going on? I feel like a prisoner in my own home. Okay, now we're getting somewhere. There's always more to it. And the team members and fees and any sort of prescriptions and supplements. So the way I work is all inclusive. So leave that thought with you. And then if we've got time, how are we doing for time? Oh my word, it flies when you're having fun, doesn't it? Have we got time for a few pointers to stay healthy and out of pain at home? Do we have time for that?
Yeah, so it's about just after 10 to 3.
Okay. All right, so Oh, I have got some breathing exercises as well, which I was hoping to get time for. Is anyone rushing off?
No, I'm not
No,
enough.
No, cool. We
No.
may overrun. I usually do.
Yeah.
So the pillars to staying healthy then are sleep and diet and water, exercise and movement, and I would say reducing stress as well. So let's look at a couple of these. They say motion is lotion, and it's important to keep moving, particularly if you're on medications for cancer that make you sort of constipated or whatever, but it keeps the fascia moving, it unsticks it all. Having a wiggle to your favorite tune doesn't have to be sort of complex, or, you know, some people are not so well, but even just a little bit of slow movement, Tai Chi, or just a sort of intuitive wiggle can be very useful. Or specific systems like yoga and Pilates, obviously, and personal workout programs. And task scrambling, like if you're going to sit at the computer, then go and do the washing. And I make sure I have to keep going downstairs to get a glass of water, and keep getting a glass of water. And this is good for everything: the heart, lungs, immune system, digestion. One way to have a really good fascial reboot is a good old pandiculation. What you're thinking when you wake up in the morning, that stretching, compressing thing that we do so very instinctively, and dogs and cats do it all the time. It's really good for you. It unsticks and reboots all that fascia and all the little restrictions, and it just feels so nice. So if you want to have a good stretch any old way during this talk or at any other time, you do it, because actually it's been shown to be absence in illness of animals as well. So yeah, have a good stretch. That you sort of stretch one way and then arch your back the other way. Notice what you do when you first wake up in the morning. You just have a good stretch in all directions. It's great fun. Water. Well, fascia is mainly made of water, and if it's dehydrated, it gets sticky. So, you know, 75% of us is water, and you think of dehydration as someone sort of being carted off to hospital, don't we? But actually, it doesn't have to be. Chronic dehydration just could be through sitting still, not moving, and not remembering to get a drink of water or whatever. It doesn't have to be water if you don't like it. And then you get stiff and sticky and achy. And some people would say, singers would say, sing wet, pee pale. But Robert Sataloff says, speak wet, pee pale. So your urine should be pale. If it's dark, you're not drinking enough. Okay. And you should be going for a pee fairly regularly, even in the heat. Okay. The fight with reality, I think we all do this, don't we? Sort of noticing your reactions. So, oh, I can feel myself getting really wound up. And you can extend the out breath. Try a couple of little breathing exercises. So to extend the out breath reduces that fight and flight response, get you into a more rest and repair response. Oh, and eat that frog. If you've got something you're really not looking forward to doing, just do it first. Don't put it off till last. Get that nasty, annoying task out of the way first. And again, doing all these things to help you relax are good for the heart, digestion, immune system, nervous system, all that sort of thing. So, a little bit of mindful breathing to finish off then. There's a few things you can try. Take them everywhere. You don't need any equipment except your body, which is great. Extending the out breath. So I'm going to get everybody just to do a few deep breaths, and we're going to, well, don't strain, do it at your own pace. We're going to start by breathing in for 3, and breathing out for 6. So in your own time, breathe in, 2, 3, and out, 2, 3, 4, 5, 6. Just do a couple of rounds of that on your own, at your own speed, no straining. If you need to speed up the count, do. Breathing in for 3, and breathing out for 6. And by all means, try different ratios. You could go 4 to 6, or 4 to 7, or 4 to 8. It needs to feel comfortable. Enough to focus you, but you should never start to feel out of breath. If you're out of breath, you need to change the count. I'm deliberately not keeping you doing this for very long, but even just for a minute or a few seconds, how are you feeling just after introducing this very briefly? What do you notice?
Very relaxed.
So if you feel very relaxed. And any other observations, actually? No, you've all gone to sleep, or you're all just chilling out, which is great.
My heart rate has slowed down.
Yeah, it will. So if you can bring about such a drastic change in your body's response within a few seconds, could you do that anywhere and everywhere? Yeah, absolutely could. Another one is alternate nostril breathing. So if you fancy having a little go at this, and bring one hand up to your face, put your index and middle finger on your eyebrow center, thumb on the right nostril, and ring finger on the left nostril. And next time you breathe out, you're going to block the right nostril, breathe out through the left, breathe in through the left, block the left nostril and breathe out through the right, in through the right, change and out through the left, in through the left, and out through the right. If your nostrils are blocked, you can practice this mentally. So imagine that you're breathing in through the left nostril and out through the right, and out in through the right, and out through the left. And that's supposed to help balance the brain. So either mentally or actually with your hand in that position is very, very good. If you're doing the mental one, you can do 2 rounds, and then you can do a round of in through both, out through both. But you sort of visualize a triangle going in through the nostril, up to the eyebrow center, and back down the nostril, and back the other way. Little triangle going from the nose to the eyebrow center and out the other side. How does that feel?
Different.
You can release the nostrils if you need to. If it's all blocked or restricted, like, again, do it mentally. Any observations with that one? I only did it very fleetingly, I know.
Often been told to breathe in through your nose and out through your mouth. Is that an alternative?
It's one way. That's more of a relaxing one. I guess if you're wanting to build energy, I've heard it said that you breathe through the nose, and if you are wanting to release energy, then breathing out through the mouth. And indeed, there are some things to cool down, but you can actually breathe in through the mouth. So there are different ways of breathing, and they all achieve different things. But those are the sort of 2 best known ones, I think. But yeah, if it works for you, if you're doing in through the nose and out through the mouth, then you can do the extended out breath. Certainly.
I've got a message on the chats from Adriana. She says she's feeling calm and she has better breathing.
Great stuff.